For years, the reputation of the Georgetown Public Hospital has been stained with countless reports of negligence, especially regarding women and children's health care. What was once a situation of mere reports of negligence has now evolved into lawsuits. To address that situation, the Ministry of Public Health is collaborating with a Canada-based charity organization and a local NGO, Help the Kids, to what was seen as an attitude problem among medical staff and other issues adversely affecting the delivery of health care. Last September, the ministry announced a decrease in neonatal deaths from 35 to 7%. Minister of Public Health Dr. George Norton commented on the matter, saying, even though this decrease was accomplished, they have not dropped their guard.
We literally had to close down our neonatal unit in order to avoid babies dying at the rate they were dying. And the majority of cause was sepsis. It means that they were becoming infected before they die.
Sepsis is defined by the Center for Disease Control and Prevention as the body's overwhelming and life-threatening response to infection which can lead to tissue damage, organ failure, and death. Minister Norton explained some of the measures the authority have implemented to bring about a decrease in neonatal deaths.
We set about doing it, closing down. We are trying to sterilize as much as possible, swabbing again, and if there are growth in bacteria, then we close down and we swab again, and we persist. And because we persist, that is why we have attained that low rate. But we cannot give up. We've got to take every situation into consideration.
Even though this much is achieved, the minister said his ministry will continue to run with the wind.
While we have achieved that at the Georgetown Hospital, we're not stopping there. It is just a question of time before we open that unit at the West Demerara Hospital. That we worked on the infrastructure. There was no doubt about it. It is air conditioned, we swabbed, but then the culture came up with some bacterial growth, so we postponed opening there. The New Amsterdam Hospital, we did close at one time. It's functioning now because the last swab they did showed no bacterial growth. We're creating one at Bartica and at Soddy. Linden Hospital is doing well. So we're hoping that we can reduce infantile mortality to even a larger extent than it is at the moment.
The issue of overcrowding at the Gphc is also a contributing factor to the neonatal death statistics. To deal with this cause, Minister Norton says maternity wards across the country are being developed. For HGP Nightly News, I am Jessica Daw.